Hi, my name is Juanita Lingle, and I will be talking about the American Heart Association hands-only CPR. Let's do a quick overview. 92% of victims who suffer from a cardiac arrest die before they reach the emergency room. And 70% of Americans today do not know how to perform CPR or do not know how to effectively perform CPR. American Heart Association introduced the hands-only CPR back in 2008. And this guideline was established to encourage any bystander who witnessed a cardiac arrest or emergency event to actively become involved in it by rendering aid, for example, by using the hands-only CPR. Most Americans feel helpless to render aid. Therefore, most Americans are reluctant to provide emergency help because they fear of hurting the victim or they feel helpless. And additionally, they also have the fear of being sued by the victim or the victim's family. The good thing is that there's a law called the Good Samaritan Law. Most states have that, and it's to protect any bystander who comes to the aid of a victim who suddenly collapsed or who has a heart attack or, a cardiac arrest. In good faith, they'll be protected under the Good Samaritan Law. Let's talk about learning hands-only CPR versus the conventional CPR. First of all, hands-only CPR is easy to learn and to remember, and it is also the most preferred CPR method used during a cardiac arrest. The hands-only CPR is used on adults and also on teens who shows obvious signs of puberty. Also, hands-only CPR has been proven to be just as effective as the conventional CPR. The hands-only survival rate doubles or triples immediately if it's used immediately after a cardiac arrest event. As you see here, hands-only CPR is explained as a CPR without the mouth-to-mouth rescue attempt. And as it's shown here, that the conventional CPR is used with a mouth-to-mouth rescue breathing. So remember, 60 seconds can save a life. So are we ready to learn hands-on CPR? Hands-only CPR. Okay, first of all, if you witness as a bystander a victim who suddenly collapses or if you recognize a cardiac arrest, you're going to check for level of response or check their level of consciousness. Does the victim have a pulse, carotid or radial pulse? You're going to check their responsiveness. Do they respond to their name when they're being called? You're going to look for obvious rise and fall of the victim's chest with every breath he takes. American Heart also explains that hands-only CPR is 2 easy steps. Number 1, it's to call 911, and the second step is to start chest compressions, push hard and fast. So step 1, call 911, activate EMS response, and immediately get an AED. Step 2 is that you're going to place hand placement on the lower half of the victim's chest, and you're going to push hard, fast, and deep. Hard, fast, and deep. The compression rate for the chest compression is going to be 100 compressions per minute, and the depth should be at least 2 inches deep. And the reason why we want to do continuous chest compression is provide adequate circulation flow to adequate oxygen blood flow to all the vital organs. So it's crucial to keep non-stop providing chest compressions and you have to limit any interruptions. That's why with hands-only CPR, we don't really emphasize on the rescue breathing at that time. Also during CPR, it's normal to have passive inhalation. so therefore the goals of the hands-only CPR is to avoid any interruptions during the chest compression, as I mentioned before. American Heart also recommends to help to keep up with the compression rate of 100 100 beats, is to hum or sing along with the Bee Gees "Staying Alive" song, and that or any song that has a similar beat in nature. So in conclusion, hands-only CPR is 2 easy steps, and remember the first one is call 911, immediately activate the 911 system and get an AED. And step 2 is immediately start chest compressions and with limited interruptions. Any questions? Okay, thank you.